Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning. Welcome to Life Happens with me, Kim Hegwood, and our very special guest today, Kimberly Pittard with Southern Touch Home Health. And so, good morning.
Good morning, Kim. Thanks for having me on today.
Not a problem. And so, we always like to showcase our referral partners and things like that. So, because y'all do such good work. So let's do this. Let's kind of give some little bit, kind of a background stuff for listeners that may not be very familiar with home health. And can you tell our listeners what services does home health provide?
So home health, a lot of people confuse home health with home care or even Medicaid provider services. Traditionally, all of us do fall into what they call as a home health category. You differentiate a little further from skilled versus non-skilled. I work with a company that does skilled services. So that means basically providing nursing, physical therapy, occupational therapy, wound care, and in some cases, maybe a short-term home health aide, which may go out maybe once a week for 20 to 30 minutes to assist with bathing, grooming, and small ADLs. So that's kind of skilled home health in a nutshell, which is what Southern Touch provides in the Houston and surrounding vicinities.
So, does Medicare pay for home health care?
Actually, yes. Medicare, Medicaid, Medicare replacements, HMOs, and PPOs. Typically, anyone age 21 on up would be classified for adult home health skilled services.
And so, well, that's good because that always helps when people know that their insurance is going to pay for it. And so
Yes.
It makes it a little easier to get. And so, and most people get referred to home health, from their doctors. And so they don't necessarily have to have a prescription for that, do they, or do they?
Actually, so we see all types of referrals. We may get a referral from, typically, we do a lot with hospitals. So if somebody's been in the hospital setting, maybe they had a stroke or they fell or just came in through the ER and were ill, we'll work with our case managers, social workers, and discharge planners. To answer your question on order-wise, yes, physicians do order home health. For home health services, you do have to have a recent encounter with a physician within the last 30 days. So it does require orders from a primary care physician. And even further, depending on that patient's insurance, what I've seen in our hospital and our rehab and nursing home settings, maybe over the past year, as some of the guidelines with Medicare and home health has changed through what they call patient-driven payment model, PDPM or PDGM, is, let's say I have AARP Medicare. It's a Medicare replacement plan. The hospitalist ordering that home health may not be covered under that particular plan. So it's going to require, we'll verify insurance, and it may say this referral requires a prescription from the patient's primary care physician because that hospitalist is at a network. So that means typically reaching out to that social worker in the skilled facility, the case manager, while they're there, saying, since they're in your care, can we get it peer-to-peer? Typically, it's just a phone call saying we have Miss Smith in the hospital here. We're trying to set up home health. However, since our hospitalist is not in network with this plan, as the home health has tried to run the benefits, can you coordinate in signing these home health orders? Typically, it's a simple phone call, but it can't be done from somebody like me. Even though I'm a rep and it was sent to me, that patient isn't in our care yet. So if I called, I could call as a courtesy, but they may say, where are you getting this referral? This patient isn't quite yours yet. So that's when we typically try to reach out with these post-acute facilities, trying to educate them on these changes with insurance. Because at the end of the day, we just want to help these residents and these patients get home safely.
So how long does the prescription cover? I mean, what's the typical time frame that a doctor will, say you need home health services?
Typically, it would depend on their particular needs. A certification period may last anywhere from 90 to 180 days, depending on what that insurance plan is. What we're coming across lately, I've noticed with our Medicare aged residents, a lot of them have gone on replacement plans, or maybe they're in that case where they're working, but they're still retired. So now they have a commercial insurance that's picking up. So you may run a plan, even though the cert period's up to 180 days. We're coming across a lot of the Blue Cross Blue Shield commercial plans, some of these plans for individuals still working that may say you have 120 visits per calendar year. Typically, if you have traditional Medicare, you can always recertify. There's not necessarily a cutoff on services, but again, you can't have a patient on constant services for a year or 2 years straight. If they have different comorbidities, or maybe I broke my hip, but I have COPD and CHF and I have wounds, well, you have 3 different criterias now you're meeting. So you may, my wound is healed. I can't recertify anymore under my wound, but I still need nursing to come and check my meds, to come check my weight, come check my blood pressure, and then the physical therapist doing therapy. So it's really what I've seen the past year to year and a half with a lot of these replacement plans, and so many people not on your traditional Medicare anymore. Some of the people don't even know. Like, we call them and we're like, you have Aetna Medicare. And they say, no, I have Aetna. It's Medicare. And I'm like, no, actually, when you signed on with Aetna, it's replaced that Medicare. So the Medicare is secondary, the Aetna is primary. Yes, it is still a Medicare plan, but the criteria is different. The visits are going to be different. Just, it's almost like they're different plans in themselves.
And so how often, you spoke just briefly, about coming out, once a week. How often can you come out? Can you come out more than that? Because I'm thinking if I wanted a shower, I'd like to have one more than once a week.
So it truly depends on the insurance. And also with our pandemic, aides are very hard to find. Typically, a home health aide may make maybe $9 to $12 an hour. And what we found with COVID, the past year and a half we've been battling it, many of these people that would typically work as an aide, they're qualifying for more with unemployment benefits than going back to work. So for nursing, typically you'll have a nurse depending on the doctor's orders. It's all going to basically depend on your physician's orders. If it's a referral for nursing with a wound, they'll typically come out 3 to 4 times a week. If it's a physical therapy referral, basically the nurse will go in and evaluate your patient. There will typically always, unless it's a physical therapy only referral, there's always at least one visit for the skilled nurse to go and admit and assess your client or your patient, or your community member. From there, they would basically call the physical therapist out, who would do an evaluation, and from there determine, based off of their patient assessment, how many days a week that client will qualify for occupational therapy, physical therapy, and speech therapy. As far as aides, in a perfect world, let's say all of us could find aides and we had aides working. It is dependent on insurance. I know a lot of these HMO plans, they may cover an aide to come out twice a week for 30 to 45 minutes. However, a lot of people confuse an aide with Medicaid provider service, which is a whole different beast. It is under the home care criteria, but there's a whole different process for qualifying that. And you may have somebody on Medicare with Medicaid secondary that truly qualifies to have somebody in there 20 hours, 30 hours, 40 hours a week. So ideally, and we can get into that later if there's questions you have on that. Ideally, if they meet the criteria for that, they may have a friend, a family member, a church member, a son, a daughter. If it's a wife that's ill, the husband could be their care provider.
So I know, back in the day that when I was in the doctor's office with my grandmother, and he says, you need home health, and here's 3 options. I'm like, which one do I pick? I don't know, and so I found that, over time, we really try to work with good people, so that we can say if a client calls, say, here's who you need to call. And if they don't service your area, they will tell you who to call. And, they know, they all know each other. And so, so if you're not one of my clients and, looking for a home health care agency, can they select their own? I mean, even if the doctor gives you, 3 options, can they select a different one?
Absolutely. So actually, I've been in this industry, gosh, almost 11 years. When I got into it, I was like, how do people do this long? Now I'm one of those gals. Typically, you're right. You really hit the nail on the head, Kim. And so a lot of us, we work friendly with our competitors. I know with the nursing shortage, I cover Houston about a 2-hour radius. But if I don't have a nurse somewhere, maybe that family, I reach out and I'm like, well, this is what an aide would cover. I don't have one. Do you truly need one? And let's say they told me yes. I would say, well, give me a few minutes. Let me connect with my friends, my colleagues, my competitors in the area that take this insurance. Because at the end of the day, I got into this. I have aging parents. I've had aging grandparents. So I think of everybody like my mom and my grandma. One day me, how would I want to be treated? So I'll reach out and see, first off, do you have an aide? Because that's the no-brainer. They need an aide. Do you take this insurance? And most importantly, do you cover the area? And since I've had this patient's permission already to connect and resource out, when I find somebody that has that fit, or let's say I found 3 people that have that fit, typically I don't like to send that one referral 3 different places. I know how frustrating it is when you get something in and you're working it to only say somebody else has picked it up, or that family to have 3 different calls. I don't feel good already. That could be really frustrating and confusing. So typically I'll send it out to the one, call the family and say, I've sent it out to XYZ Home Health. They've taken good care of our patients in the past. They cover your area. And here's the direct rep's point of contact. I typically like to refer to people I know and I've seen in the community. And the rep will let me know everything's gone smooth, or if for some odd reason they need something, we collaborate together to get them started. So absolutely, you can pick your own home health. Your doctor may have some choices, but a lot of times what we see as well, the choices that you have, everybody's insurance list changes.
Yes.
Pretty frequently.
Most definitely. So what kind of criteria? So how do we pick a good one? If I don't know anything, if you're not one of my clients and I don't send you to the good ones, and you're just somebody listening and they're saying, okay, well, I have to have a home health care company. How do they pick one? What do they look for?
So typically, if they're in the hospital or they're in a skilled facility, your case managers will typically give you a few top selections. Those are ones that are on the hospital database that they know the rep, they have a relationship with, and they know for the most part they cover the area. If it's somebody that's never been to a hospital or a nursing home, I'm just trying to figure out somebody, my doctor doesn't really have anybody, I would basically start asking in the area, Google home health care near me. You could even call your insurance and ask for a list of current approved providers in your area. Typically, a lot of us that are in contract with those HMOs, PPOs with Medicare, there's going to be a lot of us that come up. I would start asking questions. When you call up, maybe ask, is there a community liaison I can talk to? And that's where somebody like me would come in and basically talk to the family, see what they're needing, see what they need help with, make sure that we're the right fit for what they're needing. Because they may be calling for skilled, but they may need home care or provider services.
So awesome. And so, Kimberly, I just wanted to thank you for coming today. So if somebody wants to find you, how do they find Southern Touch?
So they would find us on our website, www.southerntouchhh.com. My email is kpittard@southerntouchhh.com. And my personal cell number for any questions is 832-618-2395. And I'm always happy to help. Even if it's a holiday, my phone doesn't stop.
Well, I appreciate that immensely and so much. And thanks so much for being on the show today. It's been a pleasure.
Thank you for having me, Kim. Y'all have a fabulous day. And thank you again for having us on today.
Not a problem. You as well.
Bye.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.